well. So let's see if I can get this little thing going here. I'm hitting my button and it's not going. There we go. Now we've got it going. I have to tell you guys are in for a treat tonight. I have so much information that we're going to be going over, and I've done my absolute best to organize it in such a way that you will learn something from it. I'm going to do this. I'm going to go ahead and turn this thing on. I didn't get my suit and tie on here today, but I did. I'm dressed for Missouri weather, which means that you have to wear a sweater, a t-shirt and a regular shirt, because at any moment you could take it all off or put it all back on, depending on what's going on at any given time. All right, well, welcome to tonight's GI workup, a case study. We're going to get right into this because I got to tell you, we've got a lot of information to go through. And this is important information. Stick with me. If you get bored while I'm going through this, you're going to get some nuggets in the end if you hold in there. I always like to say that, if you're bench pressing and you do rep 8, you get a lot out of that first 8, but you get a lot more over those last 2. So stick with me through this whole thing. I'm going to go through some diets. I'm going to go through some different things that can help you with yourself as well as your family and your patients. So let's start here. Gastrointestinal health, foundation of all health. If somebody comes into your office and they have bloating, constipation, diarrhea, abdominal pain, it's pretty easy. We know that they've got some abdominal problems that we're going to have to address. But sometimes GI problems come disguised. They don't have any GI symptoms. You ask them about digestion, I'm fine. Do you have constipation? No, I'm perfect. Do you have bloating? No, I'm perfect. Nothing like that. And I don't have any issues and so on and so forth. But they have multiple food sensitivities. They have increased food reaction to foods. They have chronic pain, skin issues, autoimmunity, or maybe they have fatigue, depression, poor metabolism. Any one of these things could actually point to a poor functioning digestive system. So this is a key slide right here. I want you to put this in your memory bank. Basic clinical questions to ask any patient with GI issues, right? By the way, any patients with any of these issues, right? So what kind of diet does the patient eat? So if they come in, I'll give you 2 scenarios. Nobody's alike. So somebody comes in, they have chronic fatigue, they have weight gain, they're depressed. Have you seen any of those patients in the last 3 weeks? Like, if you've been doing any work at all on this, you've seen like 100 of them, right? So depending on how many people see, nearly every other patient is going to have these symptoms. So they're fatigued, they're depressed, they've gained weight, and they can't get it under control, right? So let me give you 2 scenarios very quickly. Number one of the questions I like to ask the patient on a questionnaire is, give me a list of the 3 worst foods that you eat in an average week. And if that person puts ice cream, cookies, and Doritos, okay, that's one case scenario. The other person with the same exact symptoms, they're fatigued, they're tired, they're, weight gain, brain fog, whatever you want to list on there, same symptoms, but this one says the worst food they eat is sometimes they'll eat a soy burger, or sometimes they'll have an epic bacon bar or something like that. And the foods that are good that they eat are their, organics this, organics that, and they're limited to these foods. These are 2 different cases, because I can tell you one thing. On average, and by a long ways, the patient who's eating chips, ice cream, whatever, cookies and whatever, if you will do a good history, a physical exam, and do some blood labs on them, and maybe urinalysis, and show them what they're doing to themselves and how they're digging a grave with a fork, so to speak, with what they're eating. If you can show them that, they will be properly motivated and you will be a hero, and they'll think, oh man, that doc is really smart. Well, you just quit eating all the junk, right? And so they start doing better. Now, on the other case, you got to up your game, because you're not getting this person better by just doing off the shelf, hey, stop gluten and dairy and see how it goes for you. It's not going to work. It's not. They did that 10 years ago and 43 doctors ago, right? They already did that, right? So it's going to take a little extra work. So what I want to go through in this hour is I want to lay down a plan for a systematic way of working through the GI tract, so to speak, clinically. All right. So how long have they had the issue? If somebody's had the issue for 20 years and they've been to 13 doctors for it, and they've had no resolution to their problems, you want to think about maybe some autoimmune going down in the gut, or something that's more difficult to deal with, not simply give them a little HCl. How long have they worked on it? What have you done that's made it better and what's made it worse, right? These are all good things to know. All right, so let's move on. So the hierarchy of the GI tract. I want to introduce you to this concept of the hierarchy of the GI tract. And what do we mean by that? Well, that means that if I were to lay a foundation, if I were to build a building, let's say we're going to build a building, and this is our building, and this is a lousy looking building, right? So here's our, our window, here's our door, right? So we're building a building. Well, what do we need for that building to stand and be able to be firm on? We need a good, solid foundation. If we don't have a good, solid foundation, that house, we're taught the parable that if you build your house on sand, it's not going to last very good. You build it on a rock, and it's going to do quite well for you, right? So we have to have good foundations in everything in life. If you don't have a good foundation for anything you're doing, it's not going to be stable. If it's not stable, it's not going to work well over long term. So in GI tract terms, what I would call foundation is really basic digestion. Basic digestion. This has to do with, and we're going to walk all the way through this, it has to do with chewing your food, swallowing, HCl in the stomach, digestive enzymes come out of the pancreas, bile flow, good motility. These are all the things that make up good digestion. This is a foundation. And I want to tell you something. You'd be surprised at how many people do have difficulties with GI problems or non-GI problems that are related to the GI tract. And so many times they have a very basic one or two things off in this foundation. And guess what? They're not going to get better until they resolve this. Now, it might not be the only thing that they need to do, but you can't build a good, strong house without a foundation. So healthy immune response, these are our food sensitivities. This is leaky gut, oral tolerance, these issues. We'll talk a little bit about that. And then the microbiome, that's the good bacteria in the gut. Let's move in. All right, starting with digestion. Digestion starts with chewing the food. If you don't chew your food good, nothing really happens good below that point. How many times do you chew? Well, they say about average 30 or 40 times, but it depends on what you eat. You should basically, food should be in a mush while you swallow it. You just have to watch people if they have TMJ problems. When you do your exam, have them open their mouth. If it goes dee, 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 like this, welcome to the TMJ club. You might need to do some TMJ work. If you don't do TMJ work, refer them out to another chiropractor who does do good, solid TMJ work, and make sure their atlas is stable, and work this out. Maybe they have a dental problem that's causing TMJ. Whatever the TMJ problem is, it's either coming from one of three places. It's either the dental and how malocclusion and they're not biting down well. It's something specifically in the TMJ joint, the muscles around it needs to be worked on, or it's the upper cervical spine. It's one of those three areas, so work on that. Swallowing. Let's move on to this because this is really where we want to get to this. HCl. So when we look at the basic drawing here, here's the liver, right? And here's the gallbladder, and then we have, comes down like this, and this is our stomach. In our stomach, we have hydrochloric acid, okay? Now, sticking around here, we have a pancreas, and the pancreas dumps in right there in that sphincter of Oddi, right into the small intestine, and it joins that common bile duct right there. Okay, all right, so number one, once we get past the chewing and the swallowing, we get down into the gastric phase, and this is what I'm going to spend my time on in this webinar. So we talked in the last webinar a lot about the HCl. So I'm not going to say a lot about it. We're just going to cover it briefly. But basically, you have to have HCl. HCl, when the food mixes with the hydrochloric acid, it becomes more acidic and it's a bolus. That's why that food mixed with hydrochloric acid is called a bolus. Once the bolus moves into the small intestine, it's the acidity of that bolus, because it's mixed with hydrochloric acid, it's the acidity that triggers the pancreas to release digestive enzymes. It's the acidity that activates the gallbladder to contract to release the bile. So guess what happens good if you don't have HCl? The answer is nothing as regards to digestion. How many people are like hooked on proton pump inhibitors? How many people are just taking what are the Tums or whatever the thing is every single day without giving a thought to it, without recognizing not only are they not absorbing calcium, they're not absorbing B12, they're not absorbing iron, you're not breaking down proteins. Not only doing that, but they're creating a lot of inflammation in the GI tract. They're causing bile flow problems, digestive enzymes problems. They're causing a whole host of problems that's not just isolated to the GI tract. It can cause problems in the brain, all the way the brain to the toes. So HCl is important. The next step is digestive enzymes. How are your digestive enzymes working? The third step is how's your bile flowing, right? And then remember, the GI tract is like a river and not a pond. So you can't be constipated. If you're constipated, you have to work that out. If you'll stick with me through this webinar, I'm going to give you bullet points on each one of these. So let's get started. First, let's talk about hypochlorhydria. It's low HCl in the stomach. So if you have low HCl in the stomach, you're not going to break down your proteins, and it's going to cause you not only to not absorb your proteins well, but when proteins are not completely broken down and they hang around in the small intestine, it's a recipe for an inflammatory process. So these people are going to be inflamed. You're going to decrease your pancreatic enzyme release for the reason I just talked about, because the acidity, drop in pH is what's really activating that. You're not going to have the gallbladder contraction. You're going to have the inability to sterilize the small intestine. Guess what? When the small intestine is not properly sterilized, it can lead to things like small intestinal bacterial overgrowth, SIBO. It can lead to infections, and first line of defense for infections is HCl in the stomach. So you have to have HCl just for that. You have increased antigen exposure in the GI tract. That's what I was talking about. Things are hanging around too long in the small intestine, you have problems. It alters the intestinal pH, limiting microbiome diversity, all these things, right? So hypochlorhydria causes. I wanted to have you the benefit of this, because if you have somebody with low HCl, it's not enough just to give them HCl. You know, as a chiropractic internist, we've talked about this, we've preached about this, and we've hollered on a megaphone about this. You cannot just simply give somebody something for something and call it a day. Will you give them hydrochloric acid? Yes, but you have to figure out the mechanism or the mechanisms behind it so you can really get to the root cause of the person's problem. So there's something called gastropause, which is kind of depressing for people getting older, but by the time you hit about 55, average, you just start making less HCl. Stress, because of cortisol, you have to have thyroid hormone to make, HCl. Low chloride in your blood, medications, H. pylori infections, zinc deficiency, gastric bypass is a big one, low vagal tone, decreased chewing. If you're not chewing enough, when you chew, you actually activate your stomach to produce hydrochloric acid. So it's good to chew your food. It helps that process, gastropause and that. Okay, from a clinical standpoint, we always preach about this in the chiropractic internist work, the DAPC program, is that we don't just start with treatment. You know, there's what we used to call the Zenith High-Low history physical exam, and it went like this. The chiropractic Zenith High-Low history exam. Patient gets on the table, and they get on the high-low, right? And as they're going down, just like this, the doctor's saying, where does it hurt? It hurts over here. Okay, how long has it been hurting? About 3 months. And that's the whole history. That's all they did for the history. And then they pushed around on the back, and that was their physical exam. And that was the extent of it. I got to tell you, we can do a lot better work than that, and we really need to. So history, physical exam, figure out with labs, blood, whatever you need to do, and then you're at a place to make a reasonable suggestion for a strategy for health and life for this patient. Okay, so history for HCl evaluation. Well, we have the metabolic assessment form. We've shown you guys this before, but these questions right here, when they answer these and you have 2s and 3s, that means they experience it a lot. When you first see a patient, if you see a bunch of 2s and 3s right here, I can assure you that this is something you want to look at. These are all things that will show up when somebody has low HCl. They'll have bloating, belching, burping, offensive breath, gas immediately following a meal, sense of fullness during and after a meal, difficulty digesting fruits and vegetables, right? Okay, so for your blood patterns, when you remember, we always look for patterns, right? So if you see that, then you're going to come over on your blood and you're going to look for this. Do they have functionally low protein under 7.1? Do they have functionally low calcium under 9.2? If you have these two together, it's a pretty good sign of low hydrochloric acid. Functionally low chloride. If you have low chloride, that's also going to be a sign of hypochlorhydria. Here's a case here for us, just to look at real quick. Here's the calcium sitting at 8.5, protein at 6.2. Remember, calcium should be 9.2 to 9.7. I even like that calcium to 9.4. Protein should be 7.1 to 7.5. And if you look at this, both of those are low. If those are low, good indication. Especially you go back and look at the pattern. If the patient has filled out a bunch of this and you have this right here, you can be assured they've got low HCl. Okay, so this is just a pre-post. I want to move on. Okay, digestive clinical pearl. I want you to catch this, so important. When a patient complains, they have digestive issues when they eat, okay? When they eat meat, if somebody eats meat and they have digestive issues, think low HCl. Think low HCl, because that is a common cause. Because what does HCl do? It breaks down proteins. You eat meat, you're not breaking it down. If you have a hard time with carbs and starches, you eat those, you get bloated, and you just don't feel as good, think pancreas, low digestive enzymes. If somebody eats fried foods, greasy foods, fatty foods, or burps up fish oils or any of these kind of things, you want to think about sluggish bile flow. Okay, so all foods bloat, especially sugar, starches, and fibers. Think SIBO. And if it's a portion size, like if they eat just a little bit more than just a small amount, they have digestive issues, no matter what they eat. Then you want to think about dysautonomia. I don't have time to go into this tonight, but let me just show you that could be a problem with the vagal system, right? How the brain speaks to the gut. There's a whole, we can do a whole webinar on that alone. Okay, so so far we've talked about the importance of having a good amount of HCl. Next, I want to talk about your pancreas's ability to dump. This is a pancreas, to dump pancreatic enzymes. If you have low pancreatic enzymes, then you can have things like diarrhea, gas, bloating, abdominal pain, foul-smelling, greasy stools, and weight loss. And there's actually a syndrome that came up. It's called PED. Who knew, right? Pancreas enzyme deficiency. I think it has an ICD, whatever the number is. I don't do insurance, so I don't know that number, but it has a code. It has a medical diagnostic code to it. Pancreas enzyme deficiency. Here is our metabolic assessment form. Here's the questionnaire. If they have, if they're sitting here like this and they've got, something like this, kind of no matter what that looks like, you'll look for it through each one of these, of course. But you're going to know that, hey, I need to pay attention to digestive enzymes. Here's another thing. I like to look at this. If somebody has gallbladder problems, sorry about that. Let me ignore this here. Okay, so if somebody has gallbladder problems, right here, a lot of times they can have referred pains up in the shoulders, up in this area, or they can have pain right here. If they have problems with the pancreas, they can have that pain right there in that left side right there and right there. So that's part of the physical exam. Here are some blood patterns that you'll look for. Keep in mind, I'm just going through this really fast because I just want to lay the foundation so that when I go through the case study, it'll make more sense. At 9:30, I will stop for, I'm sorry, at 7, I'm not going to stop at 9:30. At 7:30, which is 11 minutes from now, I'm going to stop and look at questions to see if we can answer any, and then we'll go through the rest of the process. Okay, so here's some blood patterns, and if you've gone through our work, if you've been a part of the DAPC program, you've seen these before. These are things to look for to identify patterns of pancreatic enzyme deficiency. Now, as far as etiology, what if somebody has pancreatic enzyme deficiency? We do want to give them digestive enzymes, but we also want to know why. And here are 3 things that we know that can actually cause you to have low output of pancreatic enzymes. One is having low HCl because of the reason I talked about. If you have a low HCl, you're simply not triggering the pancreas to release the digestive enzymes. If you have insulin resistance, what happens is, remember, most of the pancreas is what's called an exocrine gland because it is kicking out the digestive enzymes. Well, there's about 1/7, 1/8 of the pancreas that is a endocrine gland, and it is kicking out insulin and other hormones, right? So if you're insulin resistant and you're using so much energy from the pancreas to fuel this insulin resistance, it can have a negative impact on the pancreas's ability to release digestive enzymes. So that's one thing you want to think about when somebody has insulin resistance. You want to think, do they have an enzyme deficiency? And chronic intestinal inflammation, because one of the ways that you put the fire out in the intestines, and by the way, throughout the body, is the release of digestive enzymes. Keep in mind, I love teaching principles. Think about this. When you have inflammation, it's carried by proteins. Proteins carry inflammation. What do digestive enzymes do? They break down proteins. So if you have a bunch of inflammatory proteins running around, you take some digestive enzymes, particularly on an empty stomach, then those enzymes will go out and seek those inflammatory proteins and break them down so you have less inflammation. I'm a big believer in taking digestive enzymes, not only with meals, but in between meals. All right, so let's stop here and talk about this. Here's our liver. My liver is getting worse. As the time goes on in the webinar, my liver is getting worse. All right, so hydrochloric acid in the stomach, right? Here's what I do in my practice. When somebody comes in, especially that first 12 weeks of care, I'm going to go ahead and either get them on apple cider vinegar, which is it's less caustic if they have problems with hydrochloric acid because of issues they have to have dealt with. Maybe they have food sensitivities or other things that's causing reflux or whatever. I'm going to start with apple cider vinegar, but I'm going to work them into using some HCl. I talked about that at the last webinar, how to do that very specifically. It takes time to go through that, but basically I want them taking some HCl, and in the first 12 weeks of care, I'm going to have them taking digestive enzymes. Now, I know this is a little contrary to how we generally do things. We find the mechanism and then we support those mechanisms. Well, as it turns out with the GI tract, it's so foundational to all of your health. I want to make sure I don't miss it. And at the worst, very, very worst case, you're not going to hurt somebody generally if you do it properly, giving them HCl and giving them digestive enzymes. So the first 12 weeks of care, I always do that. I may or may not bridge them off of that depending on how they do and how they respond clinically. So I'm going to go ahead and start with something that's going to support acid in the stomach, and I'm going to support digestive enzymes. Okay, now let's talk about bile flow. Isn't that a lovely picture? All right. So one of the things that bile acids do, now we all, where bile acids really get the press is that's what helps you absorb fat. If you don't have bile acids, you can't absorb fat. So guess what? If you don't have bile acids are major drivers of building microbiome diversity. And by the way, this is the holy grail of the digestive tract, is building a good microbiome. If you can build a healthy, diverse microbiome, your problems will get better. Now watch this. Now maybe there's other things going on you have to deal with, but as far as the GI tract is concerned, build a good microbiome diversity and you're going to be way ahead of the game. Now, you're not going to build a good diversity in your microbiome if you don't take care of foundations. What are foundations? You got to make sure you have HCl. You got to make sure you have digestive enzymes. You got to make sure you have good bile flow. That's what I'm talking about. And while I'm here, you have to have a good motility. And I'm going to show you some other things you're going to do as well. Okay. So one of the things bile acids do, though, is the bile acid actually goes into the small intestine here, and to help you build diversity, it's a signaling agent. It signals your colon and your small intestine, large intestine. It signals it to build diversity in the microbiome. It gives it fuel to do that, right? But 95% of the bile acids actually recirculate back to the liver, and you have this constant recirculation that's happening. All right, so if we have biliary dyskinesia, which is dyskinesia means bad movement. In other words, it's sluggish. It's fairly common. You could have poor vagal tone. A very simple way to check with a patient is have them open their mouth and say, ah, and the palate should lift up like this. It should lift up equally, and it should lift up significantly. If it does not lift up significantly, it does not lift up evenly, they have poor vagal function. The other thing you want to do is take a tongue depressor and stick it and touch the back of the pharynx on the left side, get a new one, touch the back of the pharynx on the right side. If they don't gag or they hyper gag, they have vagal issues. Either one of these, doing good upper cervical work is a good vagal activation. Also having them gargle is good. You don't need anything other than just water. You don't have to put salt, just gargling, and they should gargle loud enough that it scares everybody in the house. Like if they're not gargling that loud, they're not activating enough, right? Do that for 10 to 15 seconds, 3 to 4 times a day. That'll help strengthen the vagus nerve, all right? Now, the most obvious sign of disease, and this is biliary sludge or slow bile flow, is sharp pain in the right hypochondrium, right over that area where the liver gallbladder lives. Intermittent cramps are located in the right ribs. There are many patients who have no symptoms. By the way, did you know one of the symptoms of sluggish bile or gallstones could be something that looks like a heart attack? That's right, chest pain, panic attacks, a whole bunch of things. Other patients may feel only a vague discomfort or dull right hypochondrium. Most often pain occurs approximately 40 minutes after the patient has eaten a meal. Keep in mind, somewhere about 12 o'clock at night to 1 o'clock in the morning is a prime time when people, their gallbladder likes to act up. So sometimes you'll see, somebody eats a pizza late at night and there you go. Here's a nice picture of what that bile sludge looks like, and that's an actual bile stone. So here's some blood patterns you want to look for sluggish bile. I love this stuff. This is really good. So first off, history, and I didn't see the history, so maybe the history is coming up. Okay, I apologize. I didn't put the history in here. It's just an oversight. I put these slides together today. So if somebody, one of the most common symptoms that lets you know that somebody has bile flow problems is they don't do well with fat, greasy foods, fried foods, or they burp up fish oils. Now, you have to be careful with this, because even on the form, if you ask them, does fat bother you? And they'll say, no, fat doesn't bother me. But then you ask them and you say, well, what happens if you eat fat? And they'll say, well, I don't eat fat. Well, I know, but play along with me. If you ate fat, what would happen? Oh, it tears me up, right? So sometimes it takes a while to get to the answer. But if fat bothers them, they have a gallbladder problem. If fat bothers them, they have a bile flow problem. If they have any one or more of these, if they have one or more of these functional patterns, you always want to consider low bile flow. If they have an alkaline phosphatase that's above 80 and there's no other reason for it, think gallbladder sludge. All right, bilirubin over 0.8. If they have triglycerides lower than 75 because they're not able to absorb fat. If they have low vitamin D. Vitamin D, we get it from the sun, correct? But we also get vitamin D because it's a fat-soluble vitamin. It's a fat-soluble vitamin. And here's the deal. I have a lot of Amish. I have a lot of Mennonite people who cover up a lot. In the latitude we live in, I will generally see on average, if somebody doesn't take vitamin D, we'll see them about 28 to 32 on their vitamin D. Of course, clinical range on vitamin D is 30, but we'll see about 28 to 32 if they're not in the sun at all. Now, if somebody has a bile flow problem, you'll see that vitamin D down to 18 or 22 or 24 or something lower than 28, because what's happening is it's not the sun, it's the fact that they aren't the bile flow is not flowing properly and they're not absorbing the fat. You want to put that together with the other patterns because there are other things that could do that. Remember, you need cholesterol to help you metabolize vitamin D. So some knucklehead that I had in today, I shouldn't say knucklehead, the doctor who put him on the statin, I questioned him, but the statin, but I saw him yesterday, he's 81 years old. He's got leg pains. He's so tired he can't move. He can't make proteins. He's got an albumin globulin ratio that's 1.0. And I told his daughter, look, if you don't do something, I'm not trying to scare you here, but your dad's not going to be around in the next 2 years, maybe 3 years, if something's not done. And his cholesterol was at 82. Was it 82? Why? Because he had a heart attack like 30 years ago, right? Had a heart attack 30 years ago. And so his cardiologist, he's 81 years old. The cardiologist has put him on a statin to keep the cholesterol to 82 because he thinks that's protective of the heart. Well, the heck with everything else and every other organ in the body, right? Forget the brain, forget the liver, forget everything else. But hey, we're going to make sure you don't die of a heart attack. You're going to die of 100 other things, but you're not going to die of a heart attack. Excuse me, rant over. But anyway, here's the deal. If you have low cholesterol, You're not going to metabolize your vitamin D well, so that could be another cause. I got rabbit trailed. So sorry about that. Okay, good. Altered enzymes found in the liver. This can be a reason for, or this can be a pattern that fits the bile flow. This is the weakest one because this could be a lot of things, but these top 4 are pretty good at telling you poor bile flow. Here's just some examples. You can see, look at the enzymes. Of course, she has what's called non-alcoholic fatty liver disease. Look at the inflamed liver. But look at the alkaline phosphatase. Alkaline phosphatase is high because she has poor liver gallbladder function. Okay, that's just pre-post. This is actually just 2 weeks of getting her on a good diet. And look at that, 127, that alkaline phosphatase. And look at the enzyme in the liver, 108. It's supposed to be 18 to 26, and it's 108. That's an inflamed liver. If you look at the post, enzyme in the liver went down to 32, and alkaline phosphatase down to 91. Certainly, this person's gotten a lot healthier. We just did some liver gallbladder work. That's it. Did some dietary work, right? Here's another one. You see the cholesterol is 374. This is actually a case study I hope to get to here. But you see the triglycerides is 63. That is terrible. Why is it terrible? She's not absorbing fat. So she has a lot of problems, obviously. Her cholesterol is 374. There's problems going on somewhere. Her total cholesterol HDL ratio is not bad. So this is not a cardiovascular, believe it or not. It's not a cardiovascular case, but there's a problem. Houston, we have a problem, right? We have a problem here because the triglycerides are way too low and she's not absorbing fat. So in this patient, what are we going to do? We're going to first start with basic digestion. I want to make sure, are you chewing your food? How's the vagus nerve working? What's your HCl look like? What's your pancreatic enzymes look like? What's your bile flow look like? How are your bowels moving? And, you know, check some food sensitivities. That's where I'm going to start with this patient. Okay. Okay, patient presents with IBS, bloating, and pain. And I'll finish this and I'll go to questions. In the front lower right rib cage region. Okay, so if you look at this, look at that total bilirubin, right? Now watch, we do things by patterns. We don't just look at bilirubin and say, oh, that's what it is. But guess what? We did the history, and this is what we found. I'm trying to get my white pen out. We found lower right rib cage region pain, all right? We did abdominal exam because that's part of our process, right? And then we found bilirubin at 3.2. Can you say sluggish bile flow, right? Because here's what's happening here. Here's our gallbladder right here, right? Here's our small intestine, our stomach, and so on and so forth. So we take cholesterol, we take bilirubin, right? We put some salt in there, and we also put hormones we're trying to get, toxins, things we're trying to get out of the body, and we make bile, and bile comes down here, stores in the gallbladder, and as soon as we eat fat and the pH drops in the small intestine, the gallbladder is going to contract, release the bile, and you're going to absorb the fat, and we're all going to have a happy day. That's what's supposed to, that's what's supposed to happen. But if the bile flow is sluggish, the bilirubin can literally back up into the system and then go high in the blood like we see there. So we can see the first one is with 3.2. By the way, we want that bilirubin to be 0.5 to about 0.8, so it's 3.2, so that's quite high. Actually, that's high enough to be jaundice. The next one, it went down to 2.2. The next one, it went down all the way down to 0.7. Basically just doing liver, gallbladder support, following food sensitivities, doing some basic things in digestion. That's all we did. So 3 common mechanisms that lead to sluggish bile. If you have sluggish bile, here's 3 things that can cause these, 3 things that can lead to it. Number 1, insulin resistance. Number 2, hypothyroid. Number 3, elevated estrogen. So if you see somebody with sluggish bile, you want to look for 1 or more of these mechanisms to see if they're going on. So what's cool about the type of work we do is when you see this, it gives you a good indication and it gives you an idea what's causing the problem. Give you an idea. Here's a tree. Here are the branches on the tree. One of the branches is sluggish bile. So we go down here, we look at the root, and we find out this lady has insulin resistance and she has low thyroid. Now we're really starting to get at what we need to do clinically to get to the root cause of the problem. Here are some lifestyle strategies. I'm just going to flip this up. I'm not going to go through this a lot, but lifetime strategies lifestyle strategies for managing gallstones. 30-minute endurance exercise, aerobics, 5 times a week, actually in literature has been shown to improve bile flow. Decrease your fats and oils when you're going through a gallstone, right? Decrease fat, stop fried foods. Decrease carbs because it bumps up your insulin. Insulin slows down, makes your bile more sluggish, insulin does. Decrease your sugar, same reason. Drink coffee, believe it or not. Coffee is something that will help your gallbladder contract. Medications, if you're on hormone replacement, oral contraceptives, statins, diuretics, or chronic antibiotics, these can also cause sluggish bile. Here are some nutraceuticals, some nutrition you can use to help. This is the one I like to really go for right here. I like to use a lot of beetroot extract with vitamin C. These are all good. Phosphatidylcholine is also good. Taurine's good. These are things that will help. Remember, you're taking bilirubin and cholesterol and you're putting it into salt. And when you do that, these are things that will help you do that. So beetroot extract is excellent for that. Now, here are some things that will actually promote your gallbladder to contract. Coffee, green tea, ginger, curcumin, but also keep in mind vagal activation. Vagal activation. The vagus nerve has to function properly, right? Check that atlas, make sure it's clear. All right, so I'm going to go to, before I do this, let me just do that. I'm sorry, I'm going to have to do this. Okay, so constipation, being an older adult is a risk factor. Being a woman, just something real quick, I'll show you. If you've never seen this, here's a colon, right? And I did that exactly wrong. That's not what I wanted to do. So let's try it again. Okay. Okay, this is a colon of a man, and this is a colon. Whoops, I didn't do my thing, did I? And this is right here is a colon of a woman. So, what's the difference? Well, and I've lost my pen there, so just bear with me. So a woman's colon, naturally, because of the anatomy, comes down and it bends at the bottom, where a man just has a straight shot. So women are going to naturally have a tendency to have more constipation issues because of that. So also hormonal issues and other things can do that. So diabetes, overactive parathyroid, pregnancy, all these things, dehydration, food sensitivities, lack of microbiome diversity, hypothyroid, these are all things. So if somebody has constipation, what do you do? Somebody has constipation, you look at this list and see which one or ones apply and start working towards that, right? So here's some constipation tips. Consume high fiber foods, beans, vegetables, fruits, non-gluten grains, right? Identify food sensitivities is a must. You must do that. Improve your microbiome diversity. I'm going to show you how to do that in just a moment. Eat fewer foods with low amounts of fiber. Drink plenty of fluids. A lot of people drink too much caffeine. They don't drink enough water. Drink water. Exercise. Move your body. Watch your stress. Cortisol kills digestion. Don't ignore the urge to pass stool. So if you feel like you have to have a bowel movement, go have a bowel movement. Don't wait till, I have a more opportune time, whatever, So try to create a regular schedule for your bowel movements. That's one thing you do with children. You sit them on a potty and, make them do that. So magnesium, psyllium seed, vitamin C, center, some nutrients. There's more, but that's just where I wanted to go with that. Okay, so I'm going to see if I can answer some of these questions. Can you please speak to low hydrochloric acid and GERD? Thoughts on ACV? Suggestions on how to support patient with gallbladder, without gallbladder? Okay, so all right, so these are really good questions, and I will do my absolute best to get to the answers to those. And I don't know that I can do that right now, but we will do our best. Okay, we will try at the end of the program. I'll try to answer those. Okay, all right. So see that teaser? You have to stay now. You are almost a snooze off and like, I'm done with this. But guess what? You have to stay now if you're gonna get the answers. Okay, good. I'm just teasing with you. All right. So healthy immune response. Back up a little bit. Remember, the foundation is basic digestion. Chewing food, swallowing. How's the vagus nerve working? What's going on with HCl? What's going on with the pancreatic enzyme? What's going on with bile flow? Do you have good motility? Are you eating foods you're sensitive to? That's basic digestion. Do that. Like every single patient, if you'll just do that, and you're not doing that now, you'll see some improvements. If you're not doing that for yourself, make a checklist, every one of those. Am I chewing my food good? Am I swallowing good? Does my vagus nerve work well? Do I have enough HCl? Do I have enough digestive enzyme? How's my bile flowing? And that. and watch my food sensitivities. If you haven't had your food sensitivities tested, you need to have them tested. Okay. All right. So healthy immune response. This is the one that talks about leaky gut and oral tolerance. I just don't have time to really go through this and do it justice. I just want to say one thing. Right here's where the food is, and we have these tight junctions, and there's things that can break down these tight junctions. When they get broken down, undigested food can get in here. When it gets in there, I don't care if it's broccoli, organic broccoli coming from the most pristine garden, it's not supposed to be there. And when it gets to the white blood cells, are going to look at it and say, oh, I don't like that. I don't want that there. So then it's going to react to it. You're going to have this immune response to it, and that's going to kick off a whole host of problems. And then leaky gut begets leaky gut. So here's food sensitivities, this test that we run. In my opinion, you need to run food sensitivities on every, I try to do it on nearly every patient. I'm going to say 90% of my patients I'm doing food sensitivities on, and I don't know the exact number. I actually might be doing more than that, but I try to get it on nearly every single patient. Now, watch this. When you do food sensitivities, it's not enough. You cannot simply have people just stay off foods and stay off foods and stay off foods the rest of your life, have a good life. They narrow it down. They have 12 foods now. 2 years from now, they have 9 foods. 5 years from now, they've got 2 foods they can eat, and you just can't do that. You have to do 2 things. One, they have to avoid their food sensitivities and follow the proper areas of digestion. Number 2, we have to build a good, strong microbiome and get the gut healthy so that they can start introducing some of these foods back. So I'm going to zip through some of these. Here's some labs that you can run, and I do run these labs. It comes from Cyrex. This is array number 2, and it's an excellent lab to show if they actually have leaky gut. Don't assume everybody has leaky gut. It might not be. It could be an oral tolerance problem, a dendritic cell problem, a SIGA problem. It could be a problem somewhere else besides a leaky gut. And don't just assume that everybody has a leaky gut, because you would be assuming wrong. So you want to check leaky gut. Now, let me back up clinically. How do I do this? I'm sorry, I'm talking too fast because I'm looking at my clock here. Let me back up. The first thing I'm going to do on the average case, the very first thing I'm going to do is do this. I'm simply going to work through the foundations of digestion. Now, in my digestion package, I am adding food sensitivities. It doesn't necessarily belong there. It probably belongs more in the leaky gut, oral tolerance, issue. But it's so prevalent, I'm going to use that as a basic foundation. So, chewing, swallowing, vagus nerve, HCl, digestive enzymes, bile flow, how's the motility, and what foods are they sensitive to. That's the first step. And guess what? I'm doing that on everybody. Don't get the opinion that I do that is the only thing I do, because it's not. But I can tell you, as a foundation for all health, we need good digestion. So I do this practice on everybody. And then, depending on what the patient needs and what other patterns I find, then I'll lay things on top of that. I hope that makes sense. Now, I have either 2 cases. One, I have a more difficult case. I had a case come in from Kansas City the other day, and a very difficult case. She's been everywhere. She's been to multiple doctors, and she's just in a mess. She is in a big mess. Well, I know already. She's already done the digestive stuff. So I already ratcheted it up, and I started the next level. I did cross reactivity. I did array number 14, looking for autoimmunity in the gut. So I did a more broad workup. So that's how I would do that. The other case is I do my regular digestive stuff, and I'm just not getting where I need to go. Then I'm going to ratchet it up and do more testing and understand what's going on more in the in the oral tolerance and the leaky gut, more nuanced stuff that I would have to look at. But I just want to show you this. This is array number 2. This is array number 14. Here's some of the things it checks for autoimmunity, but it also checks things like how strong the SIGAs are. Whoops, I don't have my, let me get a different color here. How strong the SIGAs are. Are they having lipopolysaccharide? Do they have leaky gut? ASCA, ANCA, calprotectin. These are, calprotectin is found in Crohn's and ulcerative colitis, and you'll see GI autoimmunes, ASCA and ANCA can be positive. Transglutaminase 2, that's for celiac, and then I'm going to look for cross-reacting foods. So this is a wonderful panel. It hits a lot of things. So I love, love, love this panel. So it's a saliva. It's a take-home kit, very easy to do. Okay. So here's some nutraceuticals to help build the permeability of the gut. You know, this is a big one right here, butyric acid. Of course, glutamine, vitamin D, these are in order of how well they work, in my opinion. So, you know, starting from the top down. Okay, all right. Intestinal permeability, cigarette smoke, food additives, BPA, plastics, processed foods, fluorine, chlorine, heavy metal burden are all things that's going to tear that gut down. So let's move to the microbiome. This is really where I wanted to go, and then I'm going to show you a case. Now, we do have a seminar, and I want to take a moment right now and see if I have any more questions. All right, I don't see any there, but I will answer them at the end. I'm going to do my best. If you want to stick around, I'm here. So let's go ahead and do it. All right, so we have a DAPC seminar coming up. It's on autoimmune. I have to tell you, I've gone through the last few weeks reworking this autoimmune module. If you took autoimmune before with us, I'm going to encourage you to do it again, because this is not your dad's Oldsmobile. This right here, you're going to have, your socks are going to be knocked off. I'm so excited to do this seminar because it is just this good. It's actually this weekend. It's this weekend. It's this Saturday, March 6th and 7th. We're doing it in Raleigh, but we're live streaming it, so people are going to come on live stream. If you have an interest in that, you can call us at this number right here, 573-341-8292, and ask for Carrie. She can help get you set up and do that. I encourage you to do that. You're going to learn a ton of information and a lot of useful information you'll be able to use for really the rest of your clinical life. We're always growing in things, but you know, you can use that very well. All right, so microbiome. Let's cut right to the chase. How do you build a good microbiome? I can show you a lot of studies of why it's important, but let's just get to kind of the clinicals on it. These are things that you don't do, right? You know, anything that comes out of a bag or a can or a bottle, not everything, but most of these things are going to work against you building a good microbiome. Okay, remember, to build a good microbiome, you're going to need a few things. It starts with a good foundation. What's that foundation? You have to have good digestion. Everything I talked about: chewing, swallowing, vagal nerve function, HCl, pancreatic enzymes, bile flow, motility. Look for food sensitivity, identify food sensitivities. Those are things that I recommend you do. You might have some other ideas that could be helpful as well, but these are some very basic things I would recommend to do. If we don't do this and we just simply take a probiotic and call it a day, you're really going to be disappointed in your results in that. So first step to build a microbiome is to get the foundation. The foundation is digestive health. So here's some things you can do. Here's lifestyle suggestions. You want diversity in vegetables and fruits. Like if you're eating broccoli and cauliflower every single day for lunch, it's better than Skittles, right? It's better than Skittles, but you're really not building the microbiome that much because you've already seen those fibers. And how do you build the microbiome? By prebiotics. Prebiotics build probiotics. Prebiotics, what's that? Fibers. Fibers, where do you get those fibers? Fibers from fruits and vegetables, right? So we need diverse fruits and vegetables. So diverse meals, don't eat the same thing all the time. Consistent sleep pattern. Now, I usually do good on this. Last night, I was up way too late thinking about this webinar. So anyway, that's such as me. Actually, I was also preparing for the autoimmune this weekend, which is going to knock your socks off. All right, so exercise. Got to move your body. Outdoor activity. Pets. We've got to get outside. And here's the thing. You know, extremely sterile environments are actually going to work against your microbiome. Eating the same meal every day, poor sleep hygiene, sedentary lifestyle, taking antibiotics and NSAIDs, pesticides. So if you're eating a lot of vegetables, go organic. Go organic. Two reasons. Number one, you don't get the pesticides and the chemicals. Number two, remember, those organic vegetables have to fight to live. And when they have to fight to live, they grow properties within them that help you fight to live, right? Artificial sweeteners as well. Here's what I do, and here's what I suggest you to do. Something like this. I will go to the store and go to the organic section, and I will, this is on my counter, I will take that out and I will take one of everything. If I don't know what it is, I'll get two of them, right? If it's small, I get two of them. I get a bunch of stuff, right? And take it home and I chop it up. If you look at that, that's not chopped up that fine. And I've got a Vitamix. This thing is so strong, it could juice a transmission, right? So it'll, you know, I take a hand, oh, by the way, back up, let me back up. I take my Ziploc bags. I'll usually have 5 or 6 or 7 gallon Ziploc bags full of this vegetable mash. I put it in the freezer, right? And every day I open it up, take a handful, put it in my Vitamix, put some water. I like to cut up a little ginger, put it in there, make a little lime in there, put a couple of drops of stevia in there, and you know, make it where it tastes good, right? Where it doesn't taste like pond water. So I drink that up, do that every day. It's a great way to get diversity in vegetables in your system. Here's some very basic digestive things. High fiber foods, 5 colors. If you do the veggie mash, you're good to go. Psyllium, flax seed, or chia seed. Here's one thing I like to do. When I get up in the morning, I'll drink a glass of water, purified water, and then I will take some psyllium seed and put it in there and drink another glass of water with the psyllium seed. You could put flax seed, chia seed, you know, other types of seed, but it's good to help build your microbiome to do that. Do that 15 to 30 minutes before you eat, okay? Fermented foods are great if you can handle it. If you can't do it. But if you do pickled vegetables, you get a double whammy from that, because not only you get the fibers from the vegetables, but it's pickled, it's fermented, and that helps boost the growth of the microbiome diversity. Superfoods, remember, olive oil doesn't do good if you cook with it, so don't cook with olive oil. You can cook with avocado, grapeseed, coconut oils. They are pretty heat resistant, so they do pretty well. But olive oil, you want to use that on your salads, maybe put some Celtic sea salt on it, and go for it that way, and it'll taste very good. Berries are superfoods. Blueberries, blackberries, raspberries, strawberries, right? Just don't eat too many of them, but they're chock full of good nutrients that give you a lot of antioxidant support. And here's our natural antibiotics: apple cider vinegar, garlic, onions. Eat a little bit of this and eliminate these foods down here. Microbiome dietary suggestions. Okay, so you have to get north to south. You have to get the digestion working properly. You need diversity in vegetables. Avoid food sensitivities, processed foods, artificial. Don't be obsessed with hygiene. Hang around lean people. By the way, they found that if you hang around lean people, you become more lean. And they actually believe it has something to do with the microbiome. Isn't that interesting? Could have to do with habits as well. I don't know. But superfoods, fermented foods. Butyric acid is a great fuel. There's a great product that comes out of hold on a second, I'm about to run out of juice, so I better plug myself in. Okay, there's a great product that comes out of Biotics Research, and Biotics Research, Biotics Research has something called Butyr CalMag, and it's a great supplement to get the butyric acid in there. Butyric acid is the fuel that helps build the diversity in the GI microbiome. And of course, the fibers. All right, so I do want to do this case study, and I wanted to lay a foundation before I did that. Now, before I do this, let me just stop a moment and take a breath and say this. So number one, when somebody comes in and you're doing GI work, right, we want to start. Are they chewing their food well? Are they swallowing their food well? How's the vagus nerve working? How's the HCl? How's the pancreatic enzymes? How's the bile flow? How's the motility? And what foods are they eating that they're sensitive to, right? That's 1, 2, 3, 4, 5, 6, 7, 8. That's 8 steps to success. There you go. I might take swallow out and make 7 because I like the number 7. But in any case, so that's 8 steps to success. If you'll use that right there, that's a really good place to start. Then you go back and use some of these other ideas. Use some butyric CalMag, you know, maybe some glutathione, some L-glutamine, and do your diverse vegetables, do your fermented foods, your superfoods, and use some spore biotics, and this will help you build a good microbiome, and do the other things we talked about, okay? So that's basically what we talked about in this last hour. If you got that, I'm going to tell you, you got gems. These are gems. Start working on this for yourself, your family, and your patients. Okay, so let's look at the case study here. Chief complaint: bloating, gas, loose stools, and nausea, and menstrual issues. It's a 14-year-old girl. Here's some of the things that she actually recorded here. She said she had bloating, gas, loose stools, and nausea. Okay, so we have gut issues, menstrual issues. Now, if you remember when we go through the metabolic assessment, if you remember, this is the area that tells us about the colon. Now, she has enough on here that's probably a problem with the colon. If you have a problem with the colon, you probably have a problem with the microbiome. right? Poor microbiome will lead to things like that. Let me see if I can get a different color. Okay, so this one right here is the low hydrochloric acid. Look at that. She's showing up a little bit on that one too, isn't she? So she possibly has low hydrochloric acid. Doesn't tell us why, but maybe she does, right? She has a little bit of difficulty. This is greasy, high-fat foods cause a little bit of distress. Guess what? That's bile flow problems. She could have low HCl, and that could be causing the bile flow issues because her gallbladder's not contracting right. She might have an upper cervical subluxation, and the vagus nerve is compromised, and her gallbladder's not contracting right. There's a lot of things. I don't know yet. All I'm doing is looking at this and assessing. This is the one that tells me about pancreas health, the one on the lower left side right here. So she is showing some things down there as well. So maybe some issues, right? But here's the one we always come to. Remember this one. These are the 3 worst foods that she eats in a week. And she eats potato chips, white bread, dark chocolate chips. Okay. So which category does she, this is an epic bacon bar. She's eating white bread. Look at this. She's eating white bread and she has bloating and gas and loose stools and nausea. Hello. So what do we need to do with this patient? This patient is probably going to do very well by going through simple, basic digestive properties that we've described. Let's look at her blood. I love looking at blood. It gives us a good clue to really what's going on. Now, if you followed our work before, you know that we like to look at that total cholesterol to HDL ratio, and when it's below 3.1, it generally means we have immune dysregulation coming from somewhere. The most common place that's going to cause immune dysregulation is the GI tract. She's sitting at 2.7 on that. So that's a pattern that fits immune dysregulation. So is it normal for a 14-year-old to have these complaints? It's not. So that could be related. The immune dysregulation is probably an effect, if you will, of what's going on in the GI tract. All right, so let's look further. So the BUN, if you followed our work, the DAPC style, 13 to 18 is a perfect BUN. When it goes below that, it's liver congestion. So she has some liver congestion. Enzyme found in the liver is at 9. Both of those point to liver congestion, right? She also has some reactive hypoglycemia there. Okay, look at this. This is a big clue. Look at this. 17 on the vitamin D, and she is a 14-year-old girl that plays outside, and her cholesterol is not too low. This is a case of poor bile flow. So let's put some of this together and take a look. All right, so here is the liver. Here's the gallbladder. Okay, so here's the hydrochloric acid. One of the things that we found was from her questionnaire that she answered questions that was consistent with the pattern below HCl, right? We also saw a few questions that she answered that she's possibly low in digestive enzymes, okay? And number 3, not only did she say she had problems with fatty, greasy foods, but she has a low vitamin D, which fits poor bile flow because she's not absorbing fat. So she has poor bile flow. She answered questions on the colon that makes me think that she has a poor microbiome diversity. So what am I going to do? And she had low blood sugar. So what am I going to do with this patient? Well, I'm going to get food sensitivities just like I have here. Let me write this out. Here's what it's going to look like over 12 weeks. First 2 weeks are going to be the most intensive, and this is what she's going to do. Number 1, she is going to follow food sensitivities to take the stress off. We are going to do what we call blood sugar boot camp, and that's a process where we use some powders that helps the liver become uncongested to clean that out, but also to help regulate blood sugars. But in that process, it has some beetroot in it, which helps with bile flow. It has digestive enzymes in it, and we're going to add hydrochloric acid to it. So basically, we're supporting every one of those steps. We're putting her under upper cervical care. So we're going to check the atlas axis to see if there's a problem there. Maybe have her do some gargling if her vagus nerve is weak. And that's where we start. And it's not going to be any more complicated than that. And in fact, that's what we did with this patient. And she responded perfectly. Keep in mind, when you have, by the way, when you have low blood sugar crashes, it's a recipe for dysmenorrhea, and that's what she was having. So this patient, it was really that simple, wasn't any more complicated than that. Okay, so we are sitting at 8 o'clock right now. I have one more case, but what I'm going to do is, okay, let me just show you this very quickly. Give me just 3 minutes, 3 or 4 minutes, and we'll try to finish this up. Okay, let me see. I do want to say one last time, if you want to join along with us for the autoimmune seminar this weekend, I really highly encourage you to do that, because you're going to learn a ton of information, and you're going to put into practice things that help you and your family as well as your patients. So it's a really good thing. All right, so let's look at this patient. Let's look at some of her things right here. And like I said, just give me 3 more minutes. Chronic fatigue, hormonal imbalance, gut issues, constipation, brain fog, upper body pain. Wakes up exhausted even after 8 to 10 hours sleep. Prior Dutch exam, she's got adrenal fatigue. Well, no wonder. Is it going to help this person to give them an adrenal glandular? Well, no, not in the long term. It might help them temporarily. It's not going to help them in the long term because they've got lots of problems. Carbs and fibers cause them bloating. What does that mean? Could be low digestive enzymes, but it could also be SIBO. So we have to keep that in mind. She's had UTI a few years back, and since taking antibiotics, her stomach has never felt the same. She seems to suffer with chronic UTIs. Guess what? That makes me think more that this is probably SIBO, right? She's taken so many antibiotics, now she has SIBO. She had a prior test of Hashimoto's, and her test was negative. And by the way, that was just 2 months before she came in to see me. And here's all the things that she filled out. I'm only going to concentrate on the GI stuff, but look at this: poor microbiome, low HCl, poor digestive enzymes, poor bile flow, right? All of that's off. Her digestion is screwed up. Now look at this. The worst foods she eats are homemade chocolate, which is probably sweetened with stevia, pumpkin something pie, dates. She's pretty conscientious about what she eats. That doesn't reflect that as well, but she was one of these cases that really takes care. This is the one I showed you earlier here, cholesterol 374. But remember, the total cholesterol to HDL ratio was not normal. This is not from cardiovascular issue. And in fact, look at this. Her TSH was 117, right? Normal is 1.8 to 3. Her TSH is 117, right? So we went and checked Hashimoto's, because I don't take people's word for it when I see something like that. And sure enough, we checked the Hashimoto's number, and her Hashimoto's turned up positive. So she does have Hashimoto's. Look what's coming out of this thyroid. It should be 1.0 to 1.1 when it's perfect. She's 0.1. There's nothing coming out of the thyroid. She has no thyroid at all. If you have no thyroid, guess what? You have no GI tract, right? So we're going to have to support both of these. This is a complicated case, right? Of course, her sodium, this is her adrenals, that's going to be low. Anytime we need to see a sodium 140, 144, and it's 137, stress on, stress there. So that's what that looks like. She takes vitamin D. I did a cross-reactivity test on her right away because of the problems. She's cross-reacting to buckwheat, also to potatoes and rice. So she'll have to watch those. I ordered an array number 14, but this patient was just in a couple of weeks ago and hasn't come back yet. I'm going to be checking for autoimmune in the bowel. I want to check for leaky gut. I want to check for more of the cross-reactivities. I'm going to check the SIGAs. So I'm checking all of this, and so I'll have an idea of what to do with her, right? So what am I going to do with this patient? I'm going to do the same exact thing that I did with the first patient in the beginning. I'm going to work on basic foundations. I'm going to get her digestion working right. I'm going to have her swallowing. I'm going to have her checking vagus nerve, chewing, HCl, pancreatic enzymes, bile flow, motility, which she's constipated. No wonder she's, thyroid. And we're going to work on the microbiome. We're going to have her follow food sensitivities, right? So we're going to do all of those things. I did further testing because I want to know if she has leaky gut, oral tolerance problems. I got to know more because it's a more complicated case. But I don't just go to all those cool, neat things. I start here with the foundation, and then I build my house on that foundation. Okay, so I'm going to do my best to come back here and actually try to answer these questions. So, and I have a ton of questions. Can you speak to low HCl and GERD? I've never been able to wrap my head around this alleged connection. Okay, well, all right. So, okay, so I'm going to do some of these. I'll try to do it quickly. Annette, are you on here? If Annette is on here, it'll make it a lot easier because she can read the questions for me. Okay. All right. So what happens is this: HCl, when it is low, it mixes with the food, right? In the top part of your small intestine, you have things that are called the Brunner cells. These Brunner cells communicate with the brainstem, and this is what they do. When the bolus hits the very top of that small intestine, it's going to send a sample to the brainstem, or it's going to send a sample down to the small intestine. If the Brunner cells look at it and say, oh, there's not enough hydrochloric acid, this is not going to digest well, it sends a message to the brainstem. The brainstem is going to cause a contraction and cause the stomach to push the contents up. And even though it's low hydrochloric acid, it's going to feel like high chloric, because you don't have hydrochloric acid in your stomach. And I'm trying to find my questions. All right, there they go. I don't have my questions. Boy, I could really use some help on this too.
Can you hear me?
All right.
Can you not?
Okay. So let me see if I can go down to the next one. Okay. There was another question about, man, I don't. Okay. Somebody ask a question. Just ask any random question, because when you do, what's going to happen is the rest of my questions will pop up where I can see them. Okay, good. So we tricked, you know, we tricked the man, right? Thoughts on AC apple cider vinegar and histamines? Well, it just depends. If a person has high eosinophils or they react to the apple cider vinegar, you have to watch out for it. Apple cider vinegar is better than vinegar. You don't react to it as much. Okay, suggestions on how to support patient without a gallbladder. Well, in brief, what I would say is do everything we're talking about, but I like to use ox bile. Biotics has a blend. It's called something Beta Plus out of Biotics, but you have to stagger it. You know, have them take 2 a day for a couple of weeks, and then 4 a day for a couple of weeks, 6 a day for a couple of weeks, and then maybe go a couple of weeks without it, and then go back and do that routine. You have to rotate the ox bile and just see clinically how they're doing. That is your strongest thing that you can do. But also keep in mind, because they don't have a gallbladder, they still have some bile flow. So just keep that in mind. Food sensitivities. Do you eliminate plus rotate? No, I do not rotate. They have too much of a burden on their hands. And I just find that it's not as necessary as it seems academically that it would be. Okay, when do you retest food sensitivities? Well, it depends. You can retest them up to after 9 months. You may see something different, but I generally don't until at least a couple of years, because I'm going to have them work through it. Keep in mind, food sensitivity is just a target. It shows you where the target is. It doesn't show you the bullseye. It's going to eliminate enough of the foods that now they can play around with it and figure out which ones are okay and which ones are not. Keep in mind, I'm going to build this diversity in the microbiome, and then I'm going to start adding in foods, starting with vegetables and fruits, and then we're going to see how they do, see which ones we can add. I only add 1 food a week, and I'd have them eat it 3 days in a row and see if they react. If they feel tired, headache, bloated, don't sleep as good, you know, whatever the case may be, then I can tell that they're probably not going to do good with that. But if they have no reaction, I don't want them overeating it, but that's a safe food. Okay. So if you stay away from a food for 8 to 12 weeks, you're generally going to react to it when you reintroduce. What is the connection between total hydrochloric acid and immune dysregulation? Well, there's a lot. For one, if you have low hydrochloric acid, you're not breaking the polypeptides down properly, and you're not having good digestion. And so those partially broken down proteins are just hanging around the GI tract. Well, that's just a recipe for your dendritic cells say, I don't like you, and ramp up this whole inflammatory process. Okay, please remind me what markers indicate reactive hypoglycemia. That was on this one, we looked at the lactate dehydrogenase. When it's under 140, it makes us think about that. So what is the connection between total cholesterol, HDL, and immune dysregulation? Well, as it turns out, the immune system, the LDL is the carrier that carries, and I'm not drawing anything because if I draw, I lose all my questions, so I'm having to do this verbally. So I'm a drawer if you've been around me. So what happens with the cholesterol is LDL is a carrier protein, a taxicab that carries the cholesterol out to the body, to the brain, to build the hormones. But it also, if you have an infection, you will carry cholesterol to that area. If you have inflammation in the body, you'll carry cholesterol to that area. If you have immune dysregulation, there's an innate mechanism, and it's almost like the HDL is trying to call that cholesterol home. And so you're upregulating that HDL, trying to get it out of the system. And when your HDL rises like that, it's an indicator that you are immune dysregulated. Okay, in a slide a while back, you mentioned cholecystokinin. Do you see a connection between liver congestion, cholecystokinin, or low HCl? Yes, I do. Yes, I do. How do you, okay. How often do you use stool test, and what are your faves? I like doctors' data. Get comprehensive parasitology ×3. If you don't get ×3, it's not going to be a valid test when you're looking for parasites, right? If you just do a stool sample, and I learned this from a good friend of mine, I hope he's on here. I think he is, Dr. Ben Bowers. He's one of the greats in the DAPC work, but he taught me a long time ago that that a parasite, that if you do one stool, you have a 70% chance of catching the parasite, and something about 90% if you do 2 stools. But if you do 3 stools, it takes you up to about 97 to 98%. So yes, I do stools if I think that there's an infection in there, and that's a different module for a different day. I wanted to go through basic digestions on this particular module. Okay, you recommend the Array 14 over stool test. No, they're different tests. So if I feel like somebody has, I don't know if it's autoimmune, if it's oral tolerance, leaky gut, I want to know that. If I think that there's an infection, which is a whole different ball game, then I'm going to look at that. Or sometimes you can see with the comprehensive, you can see things like your digestive enzymes. You can see calprotectin, lactoferrin. If there's Crohn's disease, ulcerative colitis, you can see pathology, you see SIGAs, and that with that. But I prefer, when I'm looking at the model I'm showing you here, to use the Array number 14. But if I think there's infection, I'm going to go with the GI stool. Okay, and I like GI stool. I do a lot of them. How do you distinguish between low HCl GERD and high HCl GERD? Well, I don't. Sorry about the glib answer, but I don't. You're going to know clinically sometimes. Help with no gallbladder. Okay, so I think those are questions. If you have more questions, please write your senator. No, just kidding. If you have more questions, I'll be happy to do that. I want to invite you one more time to the seminar this weekend. I hope you guys got a lot out of this. I enjoy doing these, and I think they're fruitful. And my heart and my thing is I want you to be able to take this information and do even better work than you're doing now. Not because I think that I'm greater, but because this is good information. If you're not already applying, if you are applying, it's a good motivator to keep on that track. So thank you guys, and we will see you. If I don't see you this weekend, please come out this weekend, but if I don't, we'll be doing another webinar in about 3 or 4 weeks. Thank you very much.